To recover from a weekend, mentally and physically. Mentally, well, you're on your own. But physically, we may be able to help you out this morning. Have you ever heard of cupping? We'll explain it all. WJZ at 9 starts right here, right now.
Good morning and happy Monday. I'm Sina Geber-Ab.
And I'm Meg McNamara. Of course, we hope you had a fabulous weekend. The weather was amazing. It was gorgeous out there. And today, of course, it's rather cloudy. It definitely has a Monday-type vibe. We're going to check in with First Alert meteorologist Tim Williams on where we go from here. We are tracking some wet weather.
Indeed. We'll check in with Marty in just a little bit as well. But yes, let us start with Mr. Tim Williams.
Yes, indeed. So the weekend, I mean, that was just absolutely ideal for our last full weekend of summer, Tim.
You know, it's hard.
Mm-hmm. Well, Charm City Integrative Health is a place that's helping people to get their optimal level of wellness.
And that's where we find Marty Bass this morning. So, Marty, a great place for you to just recover from whatever kind of weekend you may have had.
And recovering in the physical sense, if you've had a weekend where you need to recover, as I said at the beginning of the show, mentally, well, you're kind of on your own. But, you know, sometimes you play a little bit too hard. Dr. Tom Ingenio.
Nice to meet you.
You have a doctorate in
acupuncture and Chinese medicine.
And it's an integrative health look at. Explain integrated health.
So integrative health is when we have a combined bunch of services that are all aimed at moving the patient forward as a whole being. So we're trying to get you healthy on every level, not just fix this part or that part.
And you do all these different therapies, oxygen therapy, red light therapy, which I think we're going to come back and do once we get into the late fall months.
Sounds good.
How many different therapies do you all provide here? This is a legitimate, for real place.
I think last time we counted, we're about 14 or 15.
But what we're talking about this morning, and I happened to mention earlier, I said cupping is something the Ravens O-line could use. Whether they won or lost yesterday, I was going to use that line because it's a very physical thing.
Yeah.
And cupping is how old?
About 4,000 years.
And the bottom line to cupping is?
We create a vacuum and it pulls circulation into that area to promote healing, relieve pain.
And you've seen the end result of cupping in all sorts of health magazines, particularly over about the past year or so. It looks like you've been holding hands with an octopus.
Yep. Michael Phelps kind of cracked it for Baltimore here in 2016.
Exactly. I was getting ready to go there. Michael Phelps is a big proponent of this.
Yeah, I mean, even this Olympics, somebody marked that there might be more cupping marks on gymnasts and Olympic athletes than there was KT tape.
Yeah. Think about that. But Michael Phelps, I remember he was standing in a bathing suit, and he had marks all over his body.
Yep.
But he was like, nope, this one I'm going to win another gold medal. Yeah,
it's so great for recovery, but it's great for everyday people too. You don't have to be an Olympic athlete or an NFL player.
Got it. Coming up after the break, we're going to talk more about. Hey, K2, I'm going to cup your mic. How'd that feel? Nice. All right. Tom, thanks for hosting us.
No problem.
Charm City Integrative Health, back to TV Hill.
Thank you, Marty.
Well, Meg, Sina, Tim, good morning. Good morning, everyone. Hopefully you had a great weekend. Let's go forward and have a great week. Meet Tasha Dooley. Welcome to WJZ at 9.
Thank you.
You are going to be getting cupped today.
Yes.
You work out a lot. You belong to the Bell?
Baltimore Kettlebell Club.
Baltimore Kettlebell is a weight that looks like a kettlebell. So, I mean, you very physical.
Yeah. Work out like 6 days a week. So coming here for recovery to be able to continue my workouts without pain has been wonderful.
And you've been doing this for about a year?
About a year, yes.
Okay, so we're not going to do it now. Coming up next half hour, you're going to see it in action. But just how did you get into cupping?
So cupping has been part and parcel of Chinese medicine since about 350 AD. And basically we do traditional fire cupping where we take an open flame, we get to play with this little torch, stick it inside, it eats the oxygen, creates a vacuum, and then we stick it on the patient, and it pulls the skin up into the cup and increases circulation.
And that's what it's all about, increasing?
That's what it's all about.
Now, how many in a regular session with Tasha, how many cups would you use?
So it depends. Really, we don't want to over cup. But this is a little bit more freeform, so if something's tight, we'll work on that. Sometimes we'll work on one area, so if it's a shoulder, you might get 4 to 6 on. If you're working the whole back, a dozen cups sometimes.
I had rotator cuff surgery about a year and a half ago on my left rotator cuff. My surgeon, shout out Dr. Tim Codd, said when he got in there, it looked like a used-up pair of pantyhose. When I was recovering, would I have been a candidate for cupping, or would that be too extreme?
No. Once the scar is closed, where they do the incisions, yes, you're free to go with cupping.
So it's that beneficial across the board.
Across the board, we see increased circulation up to 6 inches in the body. So an area like a shoulder, you're going to get cupping. You're going to get circulation through that whole joint.
Wow. So how long does it look like we're on a date with an octopus?
At first, the marks lasted maybe up to a week and a half or so.
Really?
But now, I mean, they can be a few days, maybe 5 days or so.
Do you have to? I mean, what we're talking about here is really serious. Do you have to explain it to your friends, though? They don't know you do cupping?
I've had some strangers come up to me and say, what happened to you? But once I tell them it's cupping, they recognize that. It is more prominent now, so people realize what it is.
Is there any discomfort?
No, I'm not uncomfortable during it at all.
Notice I asked the patient, not you, because you're
I'm gonna lie, right?
So, wow. Does the heat bother you?
No, nothing bothers me. It feels like a little bit of pressure, but outside of that, it's not uncomfortable whatsoever.
About 20 seconds left.
Sure.
Way back in the day in China, what was the genesis moment where somebody said this is going to work?
So the genesis moment was even pre-China. We don't exactly know where. We know it was written about in ancient Egypt in about 1515 BC.
For real?
Yeah. But we don't know the actual origin. So the idea is that at some point, somebody figured out increasing circulation was going to help promote healing, and this is one of the methods they used.
And guess what? It does. All right, coming up next half hour, we're going to go ahead and see cupping in action. But you've been hearing about it, reading about it, talking about it. Now we're going to see what it's all about. Cool. Thanks again for hosting. Thanks for being with us. Back to TV Hill.
Thank you, Marty.
And we're at Charm City Integrated Health in Canton. Dr. Tom Ingenio. Tasha Dooley, our spokesmodel, has been cupped. There'll be more cups coming on before not too long. This is a wild, Where's Marty? We've got more coming up. WJZ 9 continues. Doing all right?
Doing good.
Right after this.
Optimal levels of wellness.
And that's where we find Marty this morning doing a little cupping. Marty?
Tim, Cena, Meg, good morning, everyone. Hopefully you're doing well. Yeah, as we mentioned last half hour, you guys do so many different therapies: red light, oxygen, cold bath, cryotherapy. But cupping's a big thing these days. You tell our audience, you just told me about micro trauma.
Yeah, so the idea is that we're stressing the body a little bit to create a healing response. What happens as a side effect of cupping is we break some of those capillaries at the surface of the skin.
But you don't have to be like doing heavy workout with kettlebell like Tasha is. You could be picking up a baby. You could be picking up your groceries, and the next thing you know, you're in pain.
Absolutely. I mean, the average person we see is just trying to get through their daily life.
Wow. Show us how this happens real fast.
It's so quick.
Shockingly fast. And you're not heating the glass up. What you're doing
is... glass is kind of a bad idea. So we use the torch to quickly just eat the oxygen out of the center, and then we have a suction, right? So the cup will stay on, the skin gets pulled up, and then the skin passes into the cup, creating a space.
Let's do one more. I mean, it does happen shockingly fast.
And if I go slower, we don't create the vacuum, so it has to be that fast.
Okay, so these two right here have been on for about the past 5, 6, 7 minutes, something like that.
Yeah.
Can we take one off? Because when you take it off, you're going to hear the suction.
I'm going to try and get you the best sound possible.
Yeah, you can hear it. and there you have it. Now, how long is that going to last? It's got about a minute left.
She's really not that dark right now, and this is a good sign. Her capillaries are pretty healthy. She's been getting cupping regularly, so she's got good blood flow through there. So some people get really dark, purplish marks. Those will last for a week or two.
Wow. But it's all good.
And it should be absolutely not painful.
And so let's just say you're doing a normal back session. How many cups would you use?
It depends on the size of the person, but, a dozen is an average number. We'd probably get out on the shoulder blades here a little bit and then walk down the erectors.
Wow. All right, Charm City Integrated Health. Google it. You'll be able to find the website. Hey, thanks for hosting us.
Oh, this was great.
You doing okay?
Wonderful. Feels great.
So when you leave here, you going to the gym?
Later today.
Later today. Tell you what, we are going to come back, though, again, once we get into late fall when we start losing light. We're going to come in and do red light therapy. You find on CBS Deals, which we run at noon, there's this mask now, and it's for red light therapy. This is becoming an equally big deal, so we'll see you again.
Great.
Out of sight. All right, back to TV Hill.
All right, Marty, thank you very much.
And still to